Thank you so much, Olivia. Now, women represent the majority of the health workforce, yet they hold only 25% of leadership positions, and even lower since the pandemic started. Now, from sexual harassment in the workplace to even the lack of basic personalized protective equipment or PPE, women in the health workforce are facing challenges that affect not only their own health, but also their human rights. Here to talk about the roots of gender inequities in the health workforce, we have Gabrielle and Helen. They're representing the nonprofit organization Women in Global Health. Now, Helen, I know that you are launching a brand new chapter in Switzerland, even though your organization is global. Now, you represent the German-speaking side, and Gabrielle represents the French-speaking side, right?
First, thanks, and very much a pleasure to be here today. Maybe just a moment on women in global health, because this really is a global movement. And I think many in the room will have followed that and really seen the tremendous strides and momentum that has gathered in recent years. So yes, within that, as part of that, there's a real drive now to have country chapters. And in that sense, Switzerland is a relative newcomer. And yes, while it's extremely inclusive, the Swiss chapter should also really represent the whole of Switzerland. That was the idea. So of course, that's International Geneva, that's Human Impact 5 and Gabriella. That's many other organizations as well. And in the German part, Swiss Tropical and Public Health Institute and many other organizations, and we really hope as well to have traction also in TC. So yeah, an immediate reaction to that we really would like to reflect in the Swiss chapter the diversity of the country, all working on this question of women in global health.
Gabrielle, would you like to add anything in there? Why is it so important to have a physical presence here in Switzerland?
Well, thank you so much for the question, and thanks for having both of us. It's really exciting to be here at the Geneva Health Forum after so many years. So yes, it's really important that we have a Swiss chapter. Now, this is one of 40 chapters worldwide. So Women in Global Health Global was established in 2015, and all throughout the years, the movement has been growing. And so there are about 90 countries that are represented. There are 40 chapters. So while after so many years, you could wonder, why don't we have already a Swiss chapter? Well, a lot of the Women in Global Health work has been global, and so Global Health Geneva has really been a space where Women in Global Health has functioned. They've really been in contact and been working through the World Health Assembly and the World Health Organization. But what we really want with Women in Global Health Switzerland is a dual approach. So on the one hand, of course, Geneva is the hub of global health. And so we need to maintain that balance and support the global movement here in Geneva and the sort of global health organizations that are here. But then Switzerland is a really important country for health R&D, for research, and for its own healthcare sector. And so we really want to have this dual strategy where we really look at women in health, research, and in the healthcare workforce in Switzerland, but then also really working to link that to the global movement and to support the global movement with all the talent that we have here in Switzerland.
Okay. Now, Helen, what are your concrete actions here? I remember we talked a week before, and you were mentioning 4 specific pillars of actions that you're taking specifically here in Switzerland. So can we elaborate a little bit more on that?
Yeah, thanks for the question. I think we first of all said that we really need to look at the policy level. So we were looking at policies in Switzerland, and we're talking really here also about the Swiss health sector. We're also talking about the public health scene in Switzerland itself. So we'll be definitely looking at that as well, of course, as development cooperation as well, because of this whole global dimension. So I think there's a whole area of policy work. Another theme, and maybe Gabriele can afterwards elaborate more on that, is the whole question of data, and really having Swiss-specific data, what's happening in the Swiss workforce, being able to see how many women are coming in, studying medicine or going into positions in public health, but how many are really able to move up through the system into positions of leadership. And I think linked to that, there's this whole question of gender transformative leadership and creating opportunities. So I think another concrete strand is this whole question of mentorship. So creating opportunities for young women that are working in this space to gain in confidence, to be able to have opportunities, to be linked and networked. So I think that's looking also for champions kind of across Switzerland and of course also with this link to International Geneva. So that would be another strand. But maybe on the data you'd like to elaborate a bit more, Gabriella.
Sure. In fact, I remember you said something interesting last week, that we can't change what we can't measure. So let's elaborate a little bit about the importance of obtaining the right data.
Thank you so much. So yes, we can't change what we don't measure, and we can measure so many things. So as you said, 70% of the global health workforce is really run by women, but the decision-making roles are about 20 to 25%. And that, if you take that and you look at Switzerland, we presume that that's more or less the same case. Now, some of this still needs to be measured. And so we do know that there's about 70 to 75% of the health workforce in Switzerland that's occupied by women. The leadership positions, we need to take a closer look at that. But we presume that that's more or less the same as we see everywhere. And we know also that, here at the Geneva Health Forum talking also about, crisis and pandemics, and we know that if we don't really change the system, that the default will always go back to the way things were. And so we looked at, Women in Global Health, and many other researchers have looked also what happens in crisis situations. And we tend to go back to the default kind of male, the sort of male majority, panels who are taking decisions. And so we know that if we don't measure and push to see some more representation and more gender transformative leadership, as Helen said, in the health sector, so that means hospitals and clinics, it means research organizations, it means academia, it means public and private sector, we need to start measuring that. Now, one thing that we do sort of know anecdotally is that if we look at in Switzerland, young men and women going into the field of medicine, we know that at the early stages, so apprentice sort of interns, the majority are women. But then when we look at when those roles start to sort of transform into more decision-making roles, that the majority are men. And so we need to understand what's happening to the women. We know that they're there at the early stages, but when we look towards moving into more leadership or decision-making positions, the women are disappearing somewhere. And so we want to understand those numbers. We want to get those numbers and get them solid. And then we want to understand what the barriers are. And you mentioned sexual harassment in the workplace, and that's one of the several barriers to women's progression in the workforce in general, but in the healthcare sector in particular, because that's our area of focus.
Exactly. I believe even in your website, 1 in every 5 women in the health workforce is leaving their field, right, of place because of these challenges. So can we elaborate more on the type of challenges that women face in the healthcare field, aside from sexual harassment?
Maybe I start. I think there is a bit this feeling, and we did see it in the pandemic as well, that we tend to take the bulk of the workforce somehow for granted. And this is really where the bulk of women are working. The bulk of the workforce is really, if you look at a profession like nursing, 90% of the profession is female. But are we really, when we're taking decisions, and I'm not sure that it's even deliberate to be exclusive, but are we really stopping and just asking very simple questions? I mean, the whole question came up in the pandemic, the PPE. Did we ever pause and just stop and ask, does it fit? Is it comfortable? Is this something that's facilitating your work? So we're putting a workforce at huge risk, especially at the start of the pandemic, where we knew so little about it. The bulk of the people that were really taking care of people that were infected, that were putting themselves at high risk, they were women. But I think we just didn't stop and ask and even see all the limitations with the PPE this is one example, all the PPE that was made available. So it was kind of made for this standard small man, let's say, probably didn't fit anybody, but it really didn't fit the bulk of the workforce that was exposed and extremely exposed. And I think this was realized far too late. So I think that's one example. And then there was the whole issue of access as well. So I think then access was another question. And of course, if the bulk of the people that are actually being exposed there are women, and then they're having to reuse, then of course this is a hugely heightened risk. So I think this communication question is really part of the problem. And I think also too often we've tended to kind of throw it back to the women, that somehow, women are, they have the opportunity opportunities, but they're not taking advantage of them. But I think now the awareness is really there that it's a much more structural issue, so that it's an issue that we all have to look at, and I think it really does affect all of us. It's all these questions of, childcare, and there's so many changes going on in people's households and at a quiet level, but I think that for that really to gain the momentum and to become a moment of structural change, I think that really does take time, and that's where we may also, as a Swiss chapter, perhaps look to some of the Scandinavian chapters that have certainly, in terms of child care and dividing that really equally between whoever is in the mother and father role, dividing that equally, that's really a bit a trigger to change for those that do have families. I think that's really a barrier. So I think there are structural barriers. Then there's some of the issues you've also mentioned as well. And then I think there's simply this whole representation question. Who do you see up there talking and taking decisions? And in too many organizations, really across the world, there are female voices, there are increasingly some female places, but still there is a dominance of male leaders, and that's not being negative and it's not to criticize, but I think that is a fact, and it's going to take time to redress this issue.
Because at the end of the day, it's not about if it's a female or a male leading, it's about considering the challenges that everybody has. Something very interesting that you mentioned is the PPE, something as basic as the protective equipment. We don't think about making them personalized for breasts or hips, or maybe what they wear in the head in Muslim countries. So those are the basic things that we need to bring to the table, and sometimes it can only happen when we have the representation, because it's not like the male counterpart voluntarily don't want to think about it, but it's just that because they're not faced with those challenges, they probably don't think about it. Okay, so yes.
So we talked about some of the structural barriers, and and just talking about representation. The younger generation of women that are coming into the workforce. So we know that education levels are perfectly equal for men and women. So that's not our problem, right? So what we really need, there are a couple of things. When men and women start into their first jobs, we know that in many cases, and in Switzerland there's studies behind this to show that women and men are already having a slight pay gap. And there's no logical reason to explain it. Now, some of the pay gap in Switzerland, which has not really evolved over the past few years, is hovering around 19%, and it doesn't seem to evolve. And we know that part of that is explainable, and we know how to explain part of it. Some of it is a generational issue, because there's a generation of women that are still in the workforce that were not of our generation, the younger generations, where the educational level is the same, and the push to actually go for a career is really different. So some of these things will sort of work themselves out over time. And then part of the explainable part of it is also that there's a tendency for women to take on part-time jobs, and that's one of those structural issues around unpaid work, because we do know that women are taking on more of the unpaid work than men, although that is evolving a little bit, and we hope to see that continue. So those are some of the explainable parts, but then there's an unexplained part. And how can we explain almost half of the pay gap? And so we just can't. And so we know that there are issues around unconscious bias or stereotyping or prejudice, but it's not that women don't know how to negotiate their salaries. We know that women know how to negotiate quite well. So we need to really work on that equal pay part of the equation. I think it's really important. So if we see women at the top in leadership positions, and young women actually see themselves, young girls actually see themselves in these positions, they will start to imagine themselves. And that's a really key issue that we cannot underestimate. And then we have equal pay for equal work. And that is really an important issue, because sometimes in families, there has to be, somebody has to kind of take the slack, or take care of the kids, or there's that negotiation around who will take it. And so the person making less will tend to take on more of the care work, more of the unpaid care work. So we really need to address the pay gap. And in Switzerland, there's a strategy for that. There's a law around it. We need to really address it and take it seriously. The structural issue behind that is that we need to understand how are salaries being determined, where's the transparency around the salaries. So we really do need to tackle that. So I think that's one of the key things. The other thing, and I want to come back to this, is sexual harassment in the workplace. It's a big issue, and it's a structural issue, because we know that in Switzerland, for example, there's some new data. A big national study hasn't really taken place over a couple of years, but they're working now to get a baseline. But we know in general that about 50% of women will experience sexual harassment at some point in their careers, and about 30% 30% of women experience it every year. And so we know that this is important because sexual harassment is actually, it's structured to actually keep women down and to kind of prevent from progression. And so how do we address that in the workplace? Well, a lot of it is really just about education, it's about training, but that's not just, we can't just tick one box. And so we also really need to think structurally. How do we encourage more respectful working environments? How do we encourage more diversity in teams? Because we know where there's more gender parity, we have better functioning teams, we have more respectful working environments. So we really need to look at those structures. And also complaints mechanisms. Now, most women don't complain. Most people, because it also happens to men, of course, but most people don't complain. And they don't complain because they're afraid to lose their jobs, they're afraid that they will have some sort of repercussion. So we really need to work on having safe spaces for women to speak up and to have complaints being taken seriously. And that's one of the key reasons that people don't complain, is because they don't think it's going to be taken seriously. And it really is holding women back in the workplace in general and in global health as well.
So what are the steps that you're taking to get that right data? You're talking about the sexual harassment experiences that many women have, and obviously you're now representing the Swiss chapter. So what are the next steps that you're going to be taking to get that data to approach the change that is needed?
I think part of it is actually looking at data that may be available and bringing it together. So I think that's quite a concrete initial activity, a little bit ongoing already behind the scenes for when we come to really kind of the launch of this Swiss chapter of Women in Global Health. I think there's also really a need to start to compile more data. So I think to get clear in terms of the organizations that are involved, are there certain parameters that we can start to measure? I think this is something that Women in Global Health Global has started to do. They've looked at representation at country level, they've looked at the WHO delegations, for example. So there has already been quite a lot of groundwork done at the global level. And I think that's where we can see a bit this traction between Women in Global Health Global and then here in Switzerland, that we actually try to compile this same data, looking really more closely at the Swiss health system, and also really not to forget the whole public health scene that's ongoing here in Switzerland as well. So I think it's more that we do need to start to collect this data more routinely and to really look at it then strategically to be able to see some trends over time, because I think that's where we can really then show, are we having traction, are we making a difference? And at the same time, already some data is of course there, and we're already working on looking at that.
So a lot of what we'll do is really indeed looking at what's there and really kind of bringing in the gender transformative approach to the conversation. And so we really want to look at the data that's there. We want to mobilize the people who have the data and who can work with us. It's a volunteer organization, and so we're all busy, people working in global health, and we do need to mobilize. And that's why our launch that's going to take place, well, we've been around already for almost a year, so we exist, but as we're all working women, we've moved at the pace that we can, and now we're ready to have an inaugural event, which will take place on June 27th at 4 p.m. It will be a virtual event. And so with that, we want to start mobilizing. So all of the women that, that are working in this sector, and so far so good. I think we have a really nice group of, core group of women that have been helping us to think through these strategic approaches that we want to take. And so we'll start working on that. It's mostly through advocacy. Where there's no data, we'll try and get it. Where it is, we'll try and break it down and understand it better.
Now for the final question, we spoke about the male leaders, right? So what is the role of men in the healthcare workforce in contributing to bringing more women in the decision-making process?
Do you want me to start? Sure, yeah, go ahead. So gender equality and gender transformative or inclusive leadership is everyone's business, and it's in everyone's interest, right? So we all want to have a more equitable workplace. We all want to be able to see ourselves in leadership positions and, in all positions in the healthcare workforce. And so it's just important that we first sort of state that it's really in everyone's interest and everyone's benefit. Men, just like women leaders, have a key role to play. Gender transformative leadership or inclusive leadership is really having a vision for change. It's having a vision vision for a more equitable workspace. And that is really, that's for men leaders to do, and that's for women leaders to do, and anyone of any gender actually to do. It's all in all of our business. So if we want to see ourselves in the roles, the way that we want to see ourselves in the roles of government, we want to see ourselves in the roles of global health leaders as well. And so it's everyone's business and it's everyone's interest.
And maybe just to add, I mean, I think some of the changes that are needed, they're not changes that can be made overnight. So in terms of transition and who is coming up into leadership, the next generation of leaders, where I think things will look really different. But I think while that transition's ongoing and awareness is being built up, I think the other thing is really for male leaders to also be looking, you know, when active decisions are being taken in an organization, who are the people around the table? You know, can other people be associated to that discussion, to that decision? Even if they're not at the moment in leadership positions, can they be involved? Can they be invited in? And at those forums, can they then be empowered and really feel that they have the leadership that's there behind them to actually speak out quite openly about issues and concerns? So I think there are some intermediate steps as well, and that is this whole question of gender transformative leadership, so leadership that can really bring changes in the short and immediate term, but also with a, you know, a mid-term perspective as well.
That's a really good point. And, you know, when we do that and that becomes more of the default structure, the thinking of is everyone around the table, then we won't have situations like the one that we had with COVID, where there were, I think, 115 expert panels that got put into place to address the crisis around the world, national and global. About 85% of them were male majority, and only 3.5% of them had real gender parity. And so when we're in a crisis situation, we tend to go to a default. But what we want to do is change the default, and to change the default, we need to rethink, is everyone at the table? Do we have everyone's perspective? And it goes beyond just men and women. It goes to all genders, but it goes to the broader scope of diversity as well.
Thank you so much, Gabrielle and Helen. Definitely an imminent and vital issue impacting the future of the healthcare workforce. And I always compare taking care of doctors, of everybody who's taking care of us, like when we are in an emergency in a plane, and the security measures tell you, put that oxygen mask yourself first, and then take care of your kid. So that's very similar to what happens here. We need to take care of our caregivers so that they can take care of us in the proper way. Now, thank you again. To support and learn more about what this organization is up to, you can visit their website, www.wghswitzerland.ch. And now it's time for a break. Let's stretch your legs and enjoy some delicious snacks across the stores. We'll be back at 2 p.m. to listen to the exciting pitches about the latest health innovations. Thank you.